Welcome back to the show. The Trump administration has been doubling down on its commitment to eradicate fraud, especially among social services providers. Dr. Mehmet Oz, the administrator of the Centers for Medicare and Medicaid Services, says healthcare fraud could account for nearly half of all fraud across the federal government. He believes $100 billion has been stolen from Medicare and Medicaid programs, and that includes half of the hospices in Los Angeles. This week, Dr. Oz announced that 800 of those hospices have been suspended, saving taxpayers $1.4 billion. Some of the fraud has been tied to Somali immigrants, as in Minnesota, but one program seems to be producing fraudsters at an alarming rate. Up to 10,000 were identified by the Fraud Task Force from the Optional Practical Training Program, a visa program that allows international students to work in the U.S. for up to 12 months. The program also allows students to transition to an H-1B visa. Are there any plans for the Trump administration to scrap the program, given how much fraud it's engendered? Dr. Oz, thank you so much for joining us to discuss.
Yeah, thank you, Batya. You know, before we get to the visa issue, because it is interrelated, let's talk about fraud in general and the impact it has on affordability. So that $100 billion number that you gave is an important one, because if we could just take the fraud out of Medicare, we will double the life expectancy of the Medicare Trust Fund. What that means for everyone watching is if you're worried that Medicare may not be there for you and you're done paying into it your whole working career, that 2.9% in your pay stub, that goes to Medicare. That goes to your retirement insurance for health care. And now we can tell you it's going to last twice as long, which means you and your kids, your generations, will have a healthy program that's available, and this beautiful part of the safety net system will be intact. If we don't deal with the fraud, we also have to deal with the corruption that results from it. And the numbers you gave in California, just to remind everybody, the idea that 1/3 of all hospices in the whole country are in one city, Los Angeles, that's impossible. So clearly there was fraud. The question is, why wasn't it addressed? And the governor of California was warned by his own auditors, the state of California auditors, about this problem years ago. It took, meandering performative actions that really didn't address the core issue. And because of that, now you have that same kind of hospice fraud expanding to Nevada, where they have a 7-fold increase in the incidence of hospice now in that state. Again, you don't have 7 times more people dying in Nevada than they were dying at 5 years ago. So that's an impossible number to explain. Same problems in Arizona, Texas. So we have passed a national, nationwide moratorium, no new hospices and no new home health care until we can actually get our arms around this. Now, if you're already on these programs, stay on them. It's okay. Institutions that already exist, they'll stay intact unless we delist them, as we had to in California, because so many were blatantly fraudulent.
What I love about this is that healthcare is so important to the American people, and you are addressing the affordability piece of that. But the immigration piece is also very important. Is there any plan to address the visa problem, especially these visa programs that feed into fraud?
Without question, we have to address it. It's on the mind of the White House Anti-Fraud Task Force. To give you 2 examples, in California with this hospice fraud, we don't think that visa holders, J-1 visa holders, should be allowed to own hospices or be the named individual responsible for a hospice. And that has actually been happening. And that was one of the red flag items that we've identified to California that we are taking action on. In fact, if we see that, for example, you have a high incidence of people not dying on hospice, remember, hospice is for people in the end of life. It's a beautiful program that you enter into with the agreement of a doctor. You give up your regular insurance to go into it. If you're not ever seeing people passing in hospice, there's fraud there. If you have J-1 visa holders, to your point. But there's a bigger narrative here as well, which is in California, they are still paying for undocumented individuals to get health care. And so part of the $1.3 billion that we deferred from California this year, that the vice president announced at the event on Wednesday at the White House, was because of illegal individuals people here, undocumented individuals, getting health care services that they're not supposed to receive. And since the Working Families Tax Cut legislation was passed last year, we have been very clear with California and any other states that do this, we will not tolerate this fraud. Because here's the deal, Batya. If you're a taxpayer, federal taxpayer in New Mexico, Mississippi, New York, where we are right now with you, you should not have to pay extra taxes in order to make up for the fact that California's largesse towards undocumented individuals extends to giving free dental, free care across the free vision, free care across the board to people who are not supposed to be in this country.
Now, of course, the Democrats hate this. The media had a field day with some statistics that came out that were wrong about New York, about how many people were actually getting private personal care. What would you say to the Democrats who want to paint this as, somehow politically motivated to attack Democrat states?
You can tell people are scared when they start obfuscating what's really happening. The fact of the matter is we've been going after red states and blue states. Fraud happens all over America. In Florida, for example, we're going after durable medical equipment suppliers. We've written a letter to the state of Florida about the fact that there's 2 times more of these wheelchair-selling companies than there are McDonald's in South Florida. And we think there's Cuban government involvement in this endeavor.
Wow.
Here in New York, we know there's a massive fraud ring in Flushing, Queens, run by Chinese mafia. There might be Chinese government involvement, who knows? But we're not going to tolerate this anymore. And in New York State, for example, you've got basically a jobs program with personal care services. #1 job in the entire state is personal care service, which means you're doing things for your family that they might just do for themselves if you didn't pay them, like carrying groceries up the stairs or driving your parents to the doctor's office. And the problem with this, and this is the bigger question that we're trying to get our arms around, is why would you allow this to happen? If you're governor of a state, you think you'd want to shut down fraud, but we're seeing the opposite. We're seeing that there really is not a serious effort to deal with these crises, and part of the argument might be that it's a jobs program. You're allowing people who would have been unemployed to now get some money from the federal government because Medicaid pays for many of these services. And now we're finding out that the unions are getting involved in trying to unionize these workers. Well, that's a massive bolus of money into union dues that ends up supporting one of the political parties in New York. And we're concerned this is political patronage. And we don't want federal dollars that are supposed to be used to help our most vulnerable citizens, those on Medicare and Medicaid. We don't want those dollars being siphoned off for other purposes that may purely be used for political reasons.
And I think probably the vast majority of Americans would agree with you. I have to ask you, this week the FDA head, Marty Makary, stepped down allegedly over flavored fruity vapes, which people are worried are going to children. What happened there?
This is not about vapes. This was a decision made by Secretary Kennedy for reasons that were primarily dealing with broad issues at the FDA that that are hard to address. It's a difficult job. Marty's a superb human being, served this nation wonderfully for 15 months, and then made the decision that there are other things that he thinks are important to do in his life. He's going to land on his feet and do just great.
All right, I have to ask you about this. You did something incredible this week that has not gotten any press that I have seen, which is prior authorizations. Every American has had some nightmare scenario with a service provider to where either they didn't get the prior authorization, they had to wait for the prior authorization, they got charged because the provider didn't go out and get that. You have managed to make the private sector come to heel on one of these issues where they are so used to fleecing the American people who have already paid in some cases for these services. Tell us about this amazing initiative.
Well, you kind of bring it up. This is a classic example of how the president wants government to work. He likes to cut deals. So let's think about this. I run CMS. It's about a $2 trillion agency. I can go to Congress and say, hey, make some laws for me, but that's sometimes like taking a meat cleaver to the problem. You don't quite predict what's going to happen perfectly because there's a lot of people involved in passing a law. You can make rules. They can be challenging as well, and they take a while, and they're prone to litigation. Or you can do what the president likes, cut a deal. Use the power to convene. So we got all the insurance companies together last year and said prior authorization, this process that Americans dislike where the insurance company tells you what you can and can't do with your doctor, can be addressed by them coming up with nimble solutions that are malleable and flexible, can help the American people. And God bless them, they came together. They've already dropped by double digits the number of prior authorizations being done in this country. But we need to have the doctors and the hospitals coming to the table as well. And so this announcement this week is making it clear that we've got some of the biggest hospital systems and doctors groups and the electronic medical record folks who actually have all the information coming together and saying we're going to change the way we do business. We're going to exchange data effortlessly, seamlessly. The goal is by next year, if you need to have some type of prior authorization, it's done instantaneously. You do it quickly, effortlessly. The patient's not waiting. You want to have quality control. You want to make sure the doctors and the hospitals are doing the right thing for the patients, but you don't want to delay care. This will save time, save money, and it's the right thing for the American people. And it happened because we were willing to cut deals. Just like, Batya, as you know, with the most favored nation drug pricing, which we're going to save the American people $600 billion with over the next decade. That was done because we went to the pharma company and said, we're not going to keep paying 3 times more for the exact same drugs that the Europeans are using. We want the same pricing. The pharma sector said, fine, all right, we'll cut a deal, and they did.
Dr. Oz, God bless you and protect you. Thank you so much for your service, and thank you so much for joining us here on Batya.
God bless.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.